the pranayama that we're going to be doing today, demonstrating, is called Sheetali. Sheetali means cooling. Again, pranayamas come from yoga system, and it is a 8-limbed yoga system, and pranayamas is the 4th limb. What we know as yoga in the West, called yoga asanas, yoga poses, that is the 3rd limb. So what do the pranayamas do? They help prepare our body for the next step of meditation. They also help tone the body, tone the nervous system, and also streamline our respiratory system, clean out our respiratory passages. And to my left, I have Dr. Allie Hecht. She is a fellow in integrative medicine. And then to my right, I have Emily Schmitt. She's a 4th-year medical student. Sheetali Pranayama is cooling. And there are a couple of ways to do it. One way to do it, I can't do it, but my colleagues here can. It requires that you make an O with your tongue in your mouth. You make an O with your mouth, and then make an O with your tongue, and then breathe in through the O created by the tongue, and then breathe out through the nose. So these are normal breath. There's no effort involved. These are very, but again, these, in most of the pranayama techniques, breathing in and out are always deeper. So this is not like normal respiration. These are deeper respirations, but some are forced inhalation, some are forced exhalation, some are both. So in this one, these are normal inspiration, normal respiration. What does it do? Calms the mind, lowers blood pressure, cools off the body. Best time to do it when it's feeling hot during the summers. Again, may have some use in women who are perimenopausal having hot flushes. So that's a nice way to cool off. When to avoid it? When it's cold, when somebody has a cold or cough, or sore throat, or low blood pressure. Again, I would avoid it in POTS, partial orthostatic tachycardia syndrome, although it doesn't raise the heart rate. So we're going to try. I'm going to try one cycle of Sheetali, and then we're going to repeat it together. So, as always with most pranayamas, you start with a normal inhalation and deeper exhalation. And then from next in-breath, breathe in through the O. Breathe out normally through the nostrils. Yeah, that cooled me down. So after doing those two stimulating and heating pranayamas, I feel a lot better. I'm not sweating anymore. So let's repeat it. You guys can do the O's better than me. So we're going to start with a normal breath in and an exhalation. And make an O, breathe in. Okay. So how does it feel?
Cooler.
Cooler? Cooler, yeah. There was one study, I couldn't find the reference for it, that actually looked at the body temperature. Not through the mouth, but again, axillary body temperature. They found that it cooled the body temperature by 0.2 degree Fahrenheit, so which is significant compared to our stable homeostatic temperature of that could be different for each person. How did you feel? Did it feel calmer or more stimulating?
It was calmer, so not stimulating like the other track.
Yeah. So this is atomic pranayama. So this is one of the things to do after you do the stimulating pranayamas like Kapalbhati and Bhastrika, which are stimulating. So a few studies on this. Clinical benefits. It increases lung capacity in post-COVID patients. They did not have any long COVID, but again, these people had COVID, and immediately after the symptoms had resolved, they did this pranayama. They reported improved lung capacity. It also decreases both systolic and diastolic blood pressure in people with immediate effect. And also, it has the same thing with the long-term effect if somebody does it daily for 30 days or so. So it can decrease the baseline blood pressure and heart rate. So this study was done for 3 months. So they did pranayama, 2 rounds of 10 breaths each. So that's about the 20 breaths of slow pace Sheetali Pranayama. Sheetali is always done at a slow pace. So there are some clinical benefits to it. So, any questions?
What are some of the clinical benefits in summary?
In summary, yes. It cools the body. It also calms the mind. It also improves blood pressure. If somebody has high blood pressure issues, that can bring the blood pressure down a little bit. One of the studies, this is interesting to see. Notice this is statistically significant, is that it decreased 20 points of systolic blood pressure after doing it for 20 rounds of this pranayama. So that is a significant benefit for blood pressure. Again, no significant adverse effect except when somebody has low blood pressure or having a cold or cough. Then you don't want to cause any more problems. Then so this is one of the easier ones, especially somebody who is perimenopausal, although no studies have been done. But again, this can be helpful.